Striving for zero harm. Since the inception of the MHSC, we have worked tirelessly to make a meaningful contribution towards zero harm in the South African mining industry. To tackle such a mammoth task, dedication and cooperation are needed from all the stakeholders. The tripartite structure was created and is defined by the collaborative efforts of the state, organized labor, and the employers. And no matter what happens within the mining industry, the tripartite partners remain committed to collaborative action towards zero harm. The road to zero harm in the mining industry is long. However, it is a task that is being tackled by working alongside diverse people, collaborating to execute plans and strongly rally around this common objective. Our vision. The Mining Health and Safety Council has a vision to be the knowledge leader and trusted advisor to the Minister of Mineral Resources and stakeholders on occupational health and safety matters, and to promote the transformation of occupational health and safety in the mining industry towards the achievement of zero harm to mine workers and mining communities. Our mission. The MHSC's mission is to promote a culture of occupational health and safety in the mining industry by providing advice to the Minister of Mineral Resources, liaising with statutory bodies, fostering an effective tripartite partnership, and creating and disseminating information on leading practices to the mining industry. Our values. Our values consist of professionalism, respect, integrity, delivery, and excellence. Our goals: zero harm to employees and communities as a result of mining activities, and to provide knowledge leadership in mining occupational health and safety knowledge. South Africa's history in mining has been prosperous. April 1994, South Africa held its first democratic elections, which helped change the face of South Africa forever. May 1994, Nelson Mandela was elected president and immediately started to make changes in the mining industry. The Leon Commission of Inquiry into Mine Health and Safety was established to determine what needs to be done to improve the industry in regards to miners' health and safety within the industry. May 1995, South Africa experienced a mining disaster at the Vaal Reefs mine, where 104 miners lost their lives. The Commission of Inquiry was then spurred on to help prevent this type of disaster from ever happening again by publishing the findings on the research they conducted. Nelson Mandela had the following to say after this horrific disaster.
Our government regards it as a matter of the greatest urgency that the risks which miners face should be reduced. To this end, we are working with employers and unions to ensure that no time is lost in implementing recommendations of the Leon Commission of Inquiry into Mine Safety.
The Leon Commission published the following findings. Tuberculosis rates of 58% per thousand after 15 years of exposure. 8,000 shifts have more than 30% probability of developing silicosis. 25% of the workforce would be presented with asbestos-related diseases, including lung cancer after 20 years of exposure in asbestos mining. 50 to 60% of coal miners would develop coal miners' pneumoconiosis after 40 years of exposure. 40 to 80% of workers involved in drilling operations would have hearing problems after 10 years of exposure. These findings led to the Mine Health and Safety Act being established in 1996. To provide for protection for the health and safety of employees and other persons at mines, and for that purpose, to promote a culture of health and safety, to provide for the enforcement of health and safety measures, to provide for appropriate systems of employee, employer, and state participation in health and safety matters, to establish representative tripartite institutions to review legislation, promote health, and enhance properly targeted research, to provide for effective monitoring systems and inspections, investigations and inquiries to improve health and safety, to promote training and human resources development, to regulate employers' and employees' duties to identify hazards and eliminate, control and minimize the risks to health and safety, to entrench the right to refuse to work in dangerous conditions, and to give effect to the public international law obligations of the Republic relating to mining health and safety, and to provide for matters connected therewith. In turn, the Mine Health and Safety Council was established in 1997 as stipulated within the Mine Health and Safety Act of 1996. The journey to zero harm. The MHSC is established with 5 representatives of the tripartite stakeholder groupings from state, organized labor, and the employers. It is supported by various advisory committees in the execution of its mandate.
This year we are marking the 18th year of the existence of the Mine Health and Safety Act, which was introduced in 1996 and promulgated in 1997. The Act itself, it promoted the spirit of working together, that is of tripartism between ourselves, the state, the employers and organized labor on issues of health and safety. And I think because of that spirit of tripartism, we have achieved significantly as a mining sector, because we have acknowledged through the years that we have the same objective, that is the health and safety of the mine workers. We came up with measures, initiatives through these years to make sure that there is a significant and sustainable improvement. So I think that spirit really helped us to come to this point, and we will actually meet and consider the relevant research that we require, or the sector should require us to help us in achieving the goal of zero harm.
Occupational health and safety milestones were developed for the industry in the 2003 summit. Since that time, each year stakeholders have worked towards implementing plans to reach milestone targets.
In terms of safety, we wanted, we had a vision at the time, or a milestone, that we need to be competitive in terms of the accident rates. That's the milestones that we set ourselves. And in terms of occupational diseases, we identified 2 major occupational diseases at the time, which was the silicosis, which is a lung-related disease, and the second one was noise-induced hearing loss. So the milestone that we've set ourselves was the elimination of those 2 diseases. So there were specific milestones that we've actually established to say in 2013 certain things need to happen.
The tripartite parties considered a strategy that targeted these milestones: zero rate of fatalities and injuries. Noise from any and all equipment must be less than 110 dB. Deterioration less than 10%. Elimination of silicosis. Benchmark less than 1 fatality per 33 million hours worked by 2013. Reduction of noise-induced hearing loss. No new cases of silicosis for the new employees from 2008. The performance in the OHS sector has improved, but the challenge to improve has increased. The mandate of the Mine Health and Safety Council is to do the following: advise the Minister of Mineral Resources on occupational health and safety legislation and research outcomes focused on improving and promoting occupational health and safety in South African mines. Oversee the activities of its committees. Promote a culture of health and safety in the mining industry. Arrange a summit every 2 years to review the state of occupational health and safety at mines. Liaise with the Mining Qualifications Authority and any other statutory bodies about mining health and safety.
The purpose of the board is more of advising the Minister on Minister of Mineral Resources on health and safety matters, also to make sure that the lives of the workers are saved in the workplace. One thing that is crucial that we have achieved in the Mine and Safety Act is the 4 basic worker rights that were not enjoyed by the workers in South Africa. That Mine and Safety Act entails those rights, and as Health and Safety Council, we have been champions of those basic worker rights. And from that time, we have worked hard to make sure that the programs are in place to make sure that the lives of mine workers are improved, no one gets injured, and we found that zero harm, it is possible. If it can be done in Australia, if it can be done in Canada, if it can be done in Denmark, why not here? Because we are dealing with workers, all of us.
The MHSC's current research portfolio: airborne pollutants, occupational diseases, behavioral health and safety, explosive fires, rock bursts, rock falls, special projects, physical hazards, and lastly, machinery and transport.
The most important part in our lives is employee with safety in the mining industry. And when we talk about safety, we're not talking only about safety, we cover the health of the employees. Hence we talk about hearing issues, we're talking about silicosis. And beyond that, you become concerned about the lives of the employees. You become concerned about the lives of the mining employees. Now all that therefore makes you focus strongly on zero harm. 2013 was the first time South African mining saw a statistic of 93 fatalities in the mining industry below 100. We're coming from 300s, we're coming from the 270s. That number has come down. I know statistics at times can mislead, but it is important because that's how we track and monitor all these things. So the safety side, the Mine Health and Safety Council, which is a strong structure that has critical stakeholders in the mining industry, plays an important role. That day to day we must always think about our role as an industry and ensure that safety is paramount.
The Cultural Transformation Framework. The MHSC undertook the project Changing Minds, with the aim of developing a framework that would guide the South African mining sector into making a revolutionary change towards attaining zero harm in the sector. The vision of the CTF: every mine worker returning from work unharmed every day. In 2011, the Culture Transformation Framework was approved by the MHSC for implementation. The MHSC wants to strategize by aligning itself with strategic objectives to contribute to the National Development Plan.
The Council interrogates all this and come with innovative ways to address and resolve those issues. Sometimes it is not able to do that on its own, but it does in collaboration, for instance, with the Ministry of Health, when I'm looking at posterity or legacy issues. The industry and the department, the council set itself certain targets, and we are pleased to say since then we have realized there have been some mines that have gone on for almost a year without a single fatality and so on. If we are talking of rock falls and related things. Now, so zero harm should carry 2 elements in it. One is that as a person leaves the mine or underground or the vicinity of the mine, the person is not injured in any way physically. That is immediately noticeable. The second element of it is that we must anticipate occupational health diseases that might happen. Not, you don't see them immediately, but they happen over a period of time. Now, that's where innovation comes in terms of preventive and protective clothing and related. The most important outcome is that the department's capacity to monitor should be improved. Secondly, that the workers themselves have to be educated to take care of their own safety. And I think that is the most important element of this strategy we're talking about. So that they don't rush on production quotas, so they must take care of their own safety. Thirdly, the industry has got to play its own role. In other words, we don't expect the industry to rely only on being inspected. They must do self-inspections themselves. If we do that, this tripartite sort of initiative, I think will move a long way towards mining safety and the realization of zero harm in the industry.
The MHSC, every mine worker returning from work unharmed every day. The MHSC, every mine worker returning from work unharmed every day.